Hi everybody, Dr. Britt Talley Daniel MD, and I'm a neurologist and headache doctor, and I'm also a member of the American Academy of Neurology, the American Headache Society, and I've written a book on Transient Global Amnesia, which I published several years ago. It's the first one in 21 years. And it's a large book with several hundred pages. I'll show you a copy of it here. It's kind of shiny in this picture. And I have a picture of Gauguin there, mainly because Gauguin has this questioning look on his face, like he doesn't know what's going on. And that is because no one really understands exactly what causes transient global amnesia. There are a lot of theories, there have been a lot of things that have been looked at and not found to be truthful, but probably one of the most commonly associated conditions with transient global amnesia is being born with migraine. And migraine is genetic and it's inherited in families. So I've noted on my YouTube video for transient global amnesia, which I put up recently, has been the highest hits on anything. I've got there articles on carpal tunnel and on migraine, and I'm pleased to see that, and I know there are a lot of people in the world that are interested in this, as I have been. In the description of my book, I wrote and said it's probably one of the most perplexing, compelling neurologic conditions known to man. So today I'm going to read to you sections of the book so you can get a feel for it in a little more detail. And if you want it, you can go to Amazon.com and just in the search engine enter my name, Britt Talley Daniel, T-A-L-L-E-Y, Daniel MD, and I have 10 books there that'll come up, and this book is available as a print version, which I really encourage because you can see all the pictures and detail that are there, and it's also available as an ebook. Okay, so here we go. I want to make some comments about amnesia, because that was something that was worked out at the end of the 19th century. One of the first writers on amnesia was S.S. Korsakov, a Russian neuroscientist, and he is responsible for the so-called Korsakov Syndrome that comes in alcoholics. He wrote a series of articles in Russian in 1887 through 1891, which are not translated in English till 1955. It's kind of interesting, but I heard about this in medical school in the 60s. And Korsakov described a syndrome of anterograde amnesia, which is inability to form new memories, and confabulation in patients with severe alcoholism and polyneuropathy. So alcohol damages the brain and also memory, as you can see in this story. It also damages the peripheral nerves. You get numb, tingly feet, and that gives you what's called a polyneuropathy. Anterograde amnesia means going backwards in time. Like if I'm right now through a period of time, I can't remember 3 hours before right this moment, that would be called anterograde amnesia. No, I'm sorry, it means ongoing amnesia. We wouldn't be able to remember the next 3 hours. So, Korsakov called this psychosis polyneuritica. And I quote Dr. Benson, who's a famous writer in neurology on amnesia. He wrote in the Southern Medical Journal in 1978 and stated that he gives a definition of amnesia. What is amnesia? Quote, amnesia is a common clinical problem characterized by 4 features. Number 1, normal immediate recall. 2, impaired ability to learn. They can't learn anything. 3, they have relatively spared ability to retrieve previously learned material. So they can't remember past data. And 4, they have preserved cognitive and personality characteristics. Well, the next thing was, which neurologists always do, which was rammed in my head when I trained neurology at the Mayo Clinic in the 70s, was to try to figure out where is the problem in the brain and what's causing the problem. In 1961, Morris Victor wrote an article in the Archives of Neurology on the title of his work was Memory Loss with Lesions of the Hippocampal Formation, Report of a Case with Some Remarks on the Anatomical Basis of Memory. So he gave one of the first articles saying where does memory? And his answer was to the hippocampus. And he described, quote, a patient who had severe amnesia with visual field defects in association with occlusion of both posterior cerebral arteries in the back of the brain. The patient was observed for 5 years after the stroke and had a profound defect in recent memory. and ability to learn new facts and skills. He also had an incomplete retrograde amnesia dating back to 2 years before his stroke. That's retrograde amnesia. On examination, here's the important thing was, he had old bilateral, means both sides of the brain, infarctions, that means damaged brain tissue from stroke, in their inferior medial portions of the temporal lobe and related structures, more specifically the hippocampal formation, the fornix, and the mammillary body. I'm going to show you a picture, it's in my book, and this is a slide that shows, get this in here. Now the dark area is normal brain area, and the white area is brain cell loss. So this is in the hippocampus, and you've got this brain cell loss that's happened in this patient that's had a stroke. Now, there were early cases of what's called transient global amnesia. And one of neurology's foremost neurologic historians, J.M.S. Pierce, wrote an account about this in 2009 in European Neurology in an article called Les Ictus Amnesques. It's L-A-S-I-C-T-U-S. Ictus is an event like a seizure or a heart attack or something. A-M-N-E-S-I-Q-U-E-S, that means attack of amnesia. So, that's the first episode of this described. In March 1609, Benin was the first to report a typical case of what we would call now transient global amnesia. He defined this ictus amnesques as, quote, I'm going to quote him, clinical psychopathologic state with abrupt onset, short duration, with diffuse widespread anterograded amnesia of various depth. His patient was intended to present what's called organic amnesia, which means as a differentiated from what's called functional or hysterical amnesia, where it's all psychiatric and nothing found wrong in the brain. This is organic. And these are patients who didn't have syphilitic grand general paresis, which is a syphilitic involvement of the brain. So he discussed 4 patients with different conditions that suggested stroke or degenerative dementia, 3 of them. And he reported that patients typically asked repeated questions. So these questions are typical of transient global amnesia. And the patient said, "But where am I here? Where am I here? Where am I here?" He noted. One explains it to her, but she goes on asking. She knows whom she is during this amnestic state, but she doesn't remember her age. She recognized her husband, her children, but not everybody who would come in the house. She's asking for news of all her children, including those who died over 30 years ago. In her amnestic state, she cannot give any detail on recent events, but can speak of the past. She doesn't know, for instance, whether since she was last with her children. She forgets one moment to the other. She seems to realize that something is wrong. She says, "This is stupid to be like this." But after the episode, she'd forgotten everything. So Dr. Benin said there was no associated neurologic dysfunction. She had no psychiatric problem with delusions, hallucination. And he concluded, and again, this is 1909, early in the medical history of this thing, that this state of amnesia lasts only 4 hours and the patient comes back to her normal state. She's a bit tired and has no memory of what happened to her. During a follow-up of another 3 years, she had no further event. All right. Now, I just reviewed a paper from the Mayo Clinic writing about transient global amnesia, where the writer said there was not much relationship with migraine. So when they talk about migraine and amnesia, because there certainly is a great relationship with migraine and amnesia. And it's probably the best known condition that can cause some of it. So Living, L-I-V-E-I-N-G, he's the neurology savant, a cataloger of all things to do with migraine. He wrote this huge textbook on migraine in 1873. And Living said, "We have next to consider the disturbance of higher cerebral faculties that sometimes attends the Migraine paroxysm." In that days, we're talking about 1870s, in England, migraine was called Migraine, M-E-G-R-I-N. Later, they got the word migraine that came out of it. Paroxysm means an event. So he calls it the Migraine paroxysm, which is either intellectual or emotional. And some of these patients will have impairment of memory, and others there's confused, incoherent, or tumultuous ideation, very rarely by hallucination, and later by general depression or vague subjective feelings of anxiety and dread. Okay, he says during this period of time, her intellect, a patient he had, becomes confused, and her memory at the same time for about half an hour so impaired that she cannot remember the name of any medicine she's just taken. As the visual phenomenon passed off, memory would fail so much that for a time he was mentally incapacitated. Whatever he did or read during that time left no impression. So again, this is just documentation of relationship between memory, amnesia, and migraine. These are not actual cases of transient global amnesia. Living didn't describe the typical benign TGA episode, but he wrote an encyclopedic monograph in which he recorded the mental symptoms with memory or disturbance of consciousness. All right, so there's a strong association early on. Now, Mersch was the first neurologist at the Mayo Clinic, and he wrote in 1924 in the American Journal of Psychiatry on, quote, psychic manifestations in migraine. And he said, quote, during the clouding of consciousness, amnesia frequently occurs. And he reported patients with amnesia during migraine attacks. And he reviewed all the history up to that time. So I'm going to give you a reading of one of Dr. Mersch's cases. Case 1, a man aged 42 years had a periodic sick headache. So sick headaches goes back to Hippocrates, 300 years before Christ. A migraine turns on your vomit center. So sick headache has always been migraine. So he had periodic sick headaches associated with scotomas. That means a blind spot. He had nausea and vomiting since age 4 years old. Periodic means it would come and then go away and leave him. There's no history of migraine in his family. In July 1918, he awakened a friend by talking in a natural voice of happenings the day before. He was lying limp in bed and couldn't be aroused but had no convulsions. After about 20 minutes, he regained consciousness, was extremely nauseated, and for 2 or 3 days had a severe bitemporal headache, so a headache on both sides of the head. In June 1920, a similar attack occurred during the day in which he suddenly, while walking, became confused in mind, lasting for about nausea, headache, and vomiting. And July again in August, the same year, he had spells with sudden lapse of memory lasting for 5 to 20 minutes, followed by nausea, headache, and vomiting. All right, so Mersch commented that when one realizes the vagaries of migraine, there seems every reason to believe that these interparoxysmal mental changes are an index of innate constitutional makeup. Makeup meaning the genetic makeup of the patient with migraine. It's possible that many of the peculiarities which are ascribed to certain persons, such as occasional vague visual phenomena, mild recurring headaches and apathy, periodic mental dullness, are larvated forms of migraine. And it's also true that the headache in a migraine attack may be replaced entirely by a visual aura. You know, the migraine visual aura is usually zigzag lines or spots or holes or seeing half a thing. So it may be replaced by a visual aura, which in turn is followed by a psychic disturbance. So again, I'm documenting a Mayo Clinic neurologist describing patients with migraine having trouble with retrograde amnesia. All right, there was a Nielsen writing in Los Angeles on memory and amnesia in 1958. And he described 3 cases of what's called migrainous amnesia. Migrainous means related to migraine. He stated regarding the amnesia of migraine that, quote, amnesia occurs in attacks of migraine headache or migrainous fortification spectra and also between attacks in patients with migraine. Fortification spectra are these images that occur that look like the top of the turrets of a fort that some patients see in their eye. A spectra is like a ghostly image in their eye during a migraine attack. The amnestic symptoms are highly characteristic. Patients complain that isolated thoughts and ideas come in the mind unbidden, and those that are wanted cannot be recalled. Memory is thus spotty, quote unquote, and these islands of thought cannot be associated. At times, the difficulty in forming new memories is so great the patient has a memory for only a fraction of a minute. The duration of such attack is from 1 to 4 hours, and a given attack clears more gradually than has come. The attacks tend to come in the 20s and 30s and gradually disappear at the age of 50 approaches, and the frequency may be anywhere from 1 a week to 1 a year. So he gave a couple of other cases. Case number 2 was a nurse who noted severe amnesia accompanying her attacks of fortification spectra. That's the fortification spectra, again, means the migraine aura in her right visual fields. The attacks would last 20 minutes and followed by a headache, nausea, and vomiting. In case 3, a woman in her 20s had episodes lasting up to 6 hours, for which she had little recall. She reported, quote, attacks all her life, in which she saw colored rings and circles, which appeared to field of vision to one side in addition to sick headaches. So those are background history of just relationship between migraine. They're not having typical transient global amnesia attacks, but there is certainly this relationship with migraine and memory. But the classic attacks of transient global amnesia in the American literature started with Morris Bender, writing in 1956 in the Journal of Hillside Hospital, and he called this a syndrome of isolated episode of confusion and amnesia. And he had 12 patients that he had seen for a single brief period of defective memory and confusion with a complete retrograde amnesia. He said, this particular syndrome is difficult to classify. It doesn't seem to fit in any known etiologic category. Morris Bender. I gave an example of one of his cases in the first talk I gave. Then in 1958, the cardinal big article that most people have accepted as the best article on transient global amnesia was written by Fisher and Adams at Mass General Hospital, writing in the Transactions of the American Neurologic Association, and they gave it the name. Here comes the name. They called it Transient Global Amnesia, and this name stuck, and there's an extensive literature written in the 50s which all call the syndrome of transient global amnesia. And Fisher and Adams pointed out that the clinical manifestations were limited for the most part to defective memory involving events of recent past and present, but leaving personal identification intact. Recovery appeared to be complete. They claimed they described a distinct clinical syndrome, which has not been clearly described in medical literature. Of course, they didn't know about Morris Bender in 1956 in his article. These attacks came suddenly and without warning, or symptoms of seizure or motor or sensory deficit. So I give an example of some of Fisher and Adams' illustrative cases. Case 1. A man, age 62, while eating lunch one day, looked at his wife and said, have we been away since we came to, he named it down, everything's in a haze, I can't seem to remember anything. It became evident he could not recall the previous 2 weeks. Within an hour, memory had returned except for the events of that morning. Within 2 hours, he could recall some of the happenings of the morning, but a permanent and absolute amnesia existed for the 3 hours immediately prior to the attack. That's during a time when he's not laid down memory traces, and he has an absolute amnesia for that time. His wife had been with him the whole time. Case 2 is a man aged 56 who got out of the shower late one afternoon and appeared to have forgotten that he was scheduled to drive his daughter to the train and prepare cocktails for dinner guests. His physician found he was unable to recall any events of the day, including attending Mass. 4 hours from the apparent onset, memory was intact, but a lapse remained for the period from 4 p.m. when he entered the shower until 8 p.m. It's a 4-hour occurrence here. Case 3, a man aged 61 developed an extensive retrograde amnesia, possibly lasting several years, during sexual intercourse. The amnesia gradually shrank, and within 3.5 hours, memory was virtually normal. But there was a persistent residual memory loss for the beginning 15 to 30 minutes prior to the onset and 3.5 hours after. Case 4, a housewife aged 56 emerged from an early morning swim in the cold ocean water and proceeded to get dressed. Her husband, a physician, found that she was uncertain of her whereabouts, the time of day, the events of the hour preceding the swim, and the previous day. Memory and orientation were regained in 6 hours, but she could not recall the rest of the happenings up to the day up to 1 p.m. Another one, case 5. A woman aged 67 returned from her accustomed morning dip in the Atlantic Ocean in a bewildered state and asked, "How long have I been here? Have I had breakfast yet?" Within half an hour, her memory was returning, but for 4 hours she remained kind of hazy. All right. Now, Lewis Captain is now about 80 years old and still professor in neurology at Harvard. Defined TGA as the following. He has definitions of these. And Dr. Kaplan was kind enough to write me a letter that I could use for endorsing my textbook, and I have a quote for him on the cover of the book and also inside the book. How do you define TGA? Number 1, inability to form new memories. 2, repetitive inquiries. 3, retrograde amnesia. Initially accompanying a period of days, months, or years for the attack, but gradually shrinking after the attack, leaving permanent amnesia only for the events during the attack, and absence of other neurologic symptoms and signs. All right. In 1982, Fisher summarized 78 cases written in the Archives of Neurology on the title. The subject was Transient Global Amnesia, Presenting Activities and Other Observations. So here's a brief list of some of these things. A man was robbed in his drugstore by 2 thieves who handcuffed him. When the police arrived, he was able to tell them of the robbery before he became amnestic. Fear kind of driving that. A woman was having a tearful reconciliation with her daughter who had run away from home earlier in the day. Suddenly, she stopped crying, became quiet, and said, "Who made the supper?" having forgotten she'd prepared the meal in the previous hour. A woman's husband dropped dead before her eyes, whereupon she became amnestic for the next 18 hours. A woman whose daughter had been receiving obscene telephone calls for 5 years was one of the participants in a plan to trap the psychopath. One day, the awaited call came, and she was to set off 3 electrical signals immediately so the cops could catch him. She recalled hearing the caller's voice, but her next memory was of 2 hours later in the emergency department of the hospital. She was found in a typically amnestic state, recovery from which took 4 hours. A proud man had been obliged to resign from his long-time position, an action that hurt him deeply. On his last day of work, he got up in the morning and asked, "What was I supposed to do today?" Memory returned in about 6 hours. While sadly walking to a bank to sign a document authorizing state confiscation of his family business, a man suddenly became amnestic and forgot to keep the appointment. A woman was bitterly discussing with her husband another woman whom they blamed for the son's suicide when she asked, "Where did I get this dress?" The apartment which they lived for 9 years was foreign to her. A man was tearfully participating in a church service dedicating a pipe organ presented in the memory of his late wife and began to read the same sentences over and over. In Fisher's report, 1982, 78 cases, there were 8 events occurred during highly emotional experiences, 7 during intercourse, 6 while the patient was in pain, 3 following a dip in the cold Atlantic Ocean, and 2 during stimulation of the trigeminal ganglion. So I'm going to close off with those statements there saying, it's these unusual, probing, difficult emotional relationships and how they're described in the literature as well as what the doctor will hear in their office. And I've heard in my office cases of transient global amnesia that sets the mind to thinking and wondering what this is. So I thought I'd give a more detailed discussion of some of this. If you really want to understand it, read the book. Good luck to you, Dr. Britt Daniel, saying all you patients who have had TGA in general, there's no great history of stroke or anything else wrong with them. Patients have this should be scanned with MRI, be sure they're okay. Good luck. I'll see you later. Bye-bye.